While in the hospital, you're vulnerable to many different infections, especially if you have a weakened or compromised immune system. And some of these infections are resistant to many of the commonly used antibiotics. You may have heard of MRSA or MRSA, a resistant bacteria that can cause serious skin infections. But there's another common resistant infection that begins with bacteria that usually live in the intestinal tract. VRE.
VRE is another bacteria that we're especially concerned about. It's a short name for vancomycin-resistant enterococci. Very fancy scientific name. It's just another bacteria. We usually carry it in our bowels, as a matter of fact, that can sometimes get out of that quiet place and get into an infection.
Symptoms include fever, chills, and redness at the site of the infection. And if you experience any of these, let your healthcare provider know immediately. VRE is passed on from person to person on hands and contaminated surfaces. Make sure that you and everyone who comes in contact with you wash or sanitize their hands before and after they have contact with you. Ask hospital personnel to put on a fresh pair of gloves. If you have a urinary catheter, ask every day if it's still needed, and request that it be removed as soon as it is safe to do so. You can protect yourself from VRE and other dangerous infections by staying aware of the risks and insisting that everyone wash their hands before and after they come in contact with you.
Vancomycin-resistant Enterococcus, or vancomycin-resistant Enterococci, are bacterial strains of the genus Enterococcus that are resistant to the antibiotic vancomycin. History and biology. To become vancomycin-resistant, vancomycin-sensitive Enterococci typically obtain new DNA in the form of plasmids or transposons which encode genes that confer vancomycin resistance. This acquired vancomycin resistance is distinguished from the natural vancomycin resistance of certain enterococcal species including E. gallinarum and E. cassella flavus. High-level vancomycin-resistant E. faecalis and E. foicium are clinical isolates first documented in the 1980s. In the United States, vancomycin-resistant E. foicium was associated with 4% of healthcare-associated infections reported to the Centers for Disease Control and Prevention National Healthcare Safety Network from January 2006 to October 2007. VRE can be carried by healthy people who have come into contact with the bacteria, usually in a hospital, although it is thought that a significant percentage of intensively farmed chicken also carry VRE. Mechanism of acquired resistance. 6 different types of vancomycin resistance are shown by Enterococcus: VAN A, VAN B, VAN C, VAN D, VAN E and VAN G. The significance is that VAN A VRE is resistant to both vancomycin and teicoplanin, VAN B VRE is resistant to vancomycin but susceptible to teicoplanin, and VAN C is only partly resistant to vancomycin, and susceptible to teicoplanin. The mechanism of resistance to vancomycin found in Enterococcus involves the alteration peptidoglycan synthesis pathway. The diolanyl D-lactate variation results in the loss of one hydrogen bonding interaction being possible between vancomycin and the peptide. The diolanyl D-serine variation causes a 6-fold loss of affinity between vancomycin and the peptide, likely due to steric hindrance. Treatment of infection. Cephalosporin use is a risk factor for colonization and infection by VRE, and restriction of cephalosporin usage has been associated with decreased VRE infection and transmission in hospitals. Lactobacillus rhamnosus GG, a strain of L. rhamnosus, was used successfully for the first time to treat gastrointestinal carriage of VRE. In the U.S., linezolid is commonly used to treat VRE. See also, antibiotic resistance, drug resistance, MDR-TB, methicillin-resistant Staphylococcus aureus, XDR-TB. References. Further reading, Rastall, Bob. Gibson, Glenn. Prebiotics, Development and Application. John Wiley & Sons. ISBN 9780470023143.